Bismillahirrahmanirrahim. In the chapter of medical disorder in the pregnancy, we are looking at the hypertension disorder in the pregnant woman. So let's see. So first of all, you should be able to define some important terminologies associated with the hypertension in the pregnant woman. So number one is the gestational hypertension. If the hypertension occur after the 24 week of gestation, so this is called gestational hypertension. If the hypertension occur before the 24 hours, mean it's a chronic hypertension, mean it's the woman is already hypertensive. So it's a chronic hypertension. The next term is preeclampsia. Preeclampsia, when the hypertension is associated with the protein urea. So, mean the patient has gestational hypertension plus protein urea after the 24 weeks. So, this is called preeclampsia. Okay. So there is also superimposed preeclampsia, mean the patient has already chronic hypertension. Later, she developed the preeclampsia. This is known as superimposed preeclampsia. The next term is eclampsia. So if the preeclampsia mean the hypertension, proteinuria plus seizure, or you can say the fetus convulsion, mean there is brain involvement. So this condition is known as the eclampsia, preeclampsia, eclampsia. So once again, gestational hypertension after 24 weeks, chronic hypertension before 24 weeks, and preeclampsia, hypertension plus proteinuria, and superimposed mean already has chronic hypertension. Now she developed the preeclampsia. So this is superimposed preeclampsia. The next term is the eclampsia, preeclampsia plus seizures. Okay. When a patient develops the preeclampsia, you should try to prevent from eclampsia. How you can prevent her by giving magnesium sulfate, and you should continue after delivery because there is also the risk of postpartum preeclampsia and eclampsia. So magnesium sulfate should be continued. Okay, so this prevent from the convulsion, or you can say seizures. Okay, so magnesium sulfate is the safest drug in the preeclampsia to prevent the eclampsia. Okay. So what are types of preeclampsia? So there is a mild eclampsia, and mean the BP is above 140 over 90, and the protein urea is above 300 mg over 24 hours. So in other terms, if the diastolic BP blood pressure is greater, increase more than 15, and systolic blood pressure increase more than 30. So this is also considered as the hypertension. Okay, increase, and protein urea plus 300 mg, or if you look at the dipstick, 1 to 2 dipstick. Okay, so there is no other symptoms. Okay, so and in the severe, either it would be the uncomplicated or it would be the complicated. In the uncomplicated, there is no only the high BP, mean blood pressure more than 160 or 110 systolic, and protein urea is more than 5 gram. Okay, so 3 to 4 dipstick. And if there is no symptom and no other life changes, just increase in blood pressure and protein urea, this is uncomplicated. Complicated mean the other symptom, mean other systemic diseases you see. So then it's considered as a complicated without symptom and with symptom. Okay. So what are risk factor? The number one risk factor is the primary gravid. Mean it's a first pregnancy, and if there is extreme age, mean it's before 20 or more than 34 years. Diabetes mellitus, renal disorder, systemic lupus erythematosus, or antiphosphate syndrome. Risk factors. So number one is the gravid. I mean, it's a first pregnancy, extreme age before 20 or above 34. If it's already diabetic, and renal disorder or systemic lupus erythematosus syndrome. This will increase the risk of the hypertension or antiphospholipid syndrome. It also increase the risk of the hypertension or high level of the beta HCG. Beta HCG, it's in, for example, in case of vascular mole, in the molar condition, molar pregnancy, there is high level of the HCG. Or if it's a multi-fetal gestation, mean more than one fetus, so there is a high level of HCG. High level of HCG also is a risk factor for the hypertension. Okay. So how this hypertension develop? If you look at this is non-pregnant woman, and here is a normal pregnancy. If you look at what is happening in the before and after, this is the spiral artery. Okay, so when the woman become pregnant, so this area, this blood vessel dilate here. Okay, so this increase the blood supply to the fetus. So if this dilation not occur, mean like here it's a narrow. Okay, so if there is a narrow blood vessel, there is what will happen? Decrease the placental perfusion. So decrease placental perfusion, what will happen? So this will increase the release of toxic mediator. Okay, so these toxic mediator go to the throughout the body, so it affect the liver, where it cause increase their enzyme release. If it involve the brain, it cause the seizure. If it involve the retina, it cause blurry vision. If it's affecting the kidney, it cause the proteinuria, oligonuria in the blood vessel. It cause hemolysis. Okay, so the major problem is what is the narrow blood vessel. So this decrease the increase the vascular resistance, which cause the release of toxic material that affecting the other organ. Okay, so decrease placental perfusion. So it may cause intrauterine growth retardation, oligohydramnion, chronic fetal distress. So these are all due to decrease placental perfusion. Okay. So if you look at the same mechanism here, so placental perfusion, endothelial injury, vasoconstriction, generalized vasoconstriction, which decrease the aldosterone level. So this causes maternal hypertension, decrease the placental perfusion, and decrease maternal plasma volume. Okay. So if there is a decrease the placental perfusion, so it causes a trophoblast injury. So there will be a trophoblast fragment which go into the lung, where they release the thromboplastin and increase the intravascular, which causes the intravascular coagulation and the fibrin deposition. So this do what? This decrease the blood supply to the kidney. We decrease the GFR. When there is GFR decrease, it further increase the vasoconstriction. So you can see it's the condition is worsening more and more. Okay. So if the fibrin deposition in the CNS, it causes convulsion, which is eclampsia. Okay. So this is the pathogenesis of the preeclampsia, or you can say hypertension in the pregnancy and proteinuria. Okay. So what are the signs of preeclampsia? Just remember PRE. So you can define it. P proteinuria, R rising blood pressure, E for edema. Oh, it's edema because when there is a perfusion, so there is when there is a blood vessel damage, so there is a leakage of the leakage of the protein or the other content through the blood vessel that cause the edema. Okay. So three major factors: protein in the urine, the high blood pressure more than 140 over 90, and the swelling of the hand and face. So these are three signs of preeclampsia. Okay. So the other symptom you will see in case of this severe condition. Okay. So especially in the complicated. So you will see you look at from above to down. So there is persistent headache due to cerebral edema, and you will see the blurry. The patient is blurry and seeing spots, and due to decreased cerebral perfusion, which cause affecting the retina. Okay, difficulty in breathing due to pulmonary edema and cyanosis. There is abdominal pain and shoulder pain. This is due to the stretching of glycine capsule, or you can say the liver capsule, which cause the epigastric pain, or you can say upper abdomen or shoulder pain, and nausea vomiting. It's the second half in the second half of pregnancy, and you see the sudden weight gain due to and there is edema and sudden swelling in the face and hands. Okay, and there is a condition which is HELP syndrome. And HELP syndrome mean H represent hemolysis, E represent elevated liver enzyme, and LP represent low platelet. Okay, so hemolysis, when there is a hemolysis mean there is vasoconstriction. For example, if you see here. Uh, if there is a this is blood vessel and there is vasoconstriction, the different blood cells are coming here, so they stuck here. So this causes the hemolysis, and there is also the platelet damaging. So this all will this will cause the HELP syndrome, mean hemolysis, mean blood cell damaging, and the platelet are damaging. So this decrease the platelet level. Okay. Uh, so hemolysis increase liver enzyme platelet count. Okay, and thrombocytopenia, I mean there is low platelet level. Okay, so macroangiopathy, hemolysis due to vasospasm. So this is also summary of placental hypoperfusion, systemic vasoconstriction, endothelial dysfunction. So this is called the end organ damage, proteinuria. So this is the HELP syndrome. Okay. So, what investigation you do for in case of preeclampsia, eclampsia? Urinalysis, you go to check out the proteinuria, CBC for hemolysis, or thrombocytopenia, LDH for hemolysis, and BMP to check out the renal function. Okay, AST, for the elevated liver enzyme, PT, to check out the coagulopathy, and uric acid to check out the AC level, mean albumin, creatine ratio, and the maternal renal injury, and which indicate the preeclampsia or the superimposed on chronic hypertension. So these are tests you should go for if you suspect the preeclampsia. Okay. So this is summary of what we have discussed before 24. It's a protein with proteinuria preeclampsia. Without proteinuria, it's a gestational hypertension. After 24 week, before 24 week, it's a chronic hypertension or superimposed preeclampsia condition. Okay, so this is these are the risk factor, and what are the complications? There will be a placental abruption and acute renal failure and the intracranial hemorrhage, DAC, retinal detachment. So these are all due to the hypoperfusion. Okay, placental insufficiency, liver hematoma, prematurity. So how do you treat this patient? So first of all, the major treatment is to remove the placenta. So because there is hypoperfusion, it will worsen the condition. So uh, you look at the maternal and fetus. Okay, so if it's 34, the gestational age is above 34, go for the delivery. Simple. If it's if it reaches 34 and above, you look at the other condition. If it's a severe preeclampsia and if it's a rupture of membrane and abnormal fetal testing, then you go for the fetal delivery. And otherwise, you should wait for the 34 weeks, 37 weeks. Sorry. Okay. If it's below that, mean it's not reached 34, and the condition is severe disease. Okay, so you continue the steroid, antihypertensive. Okay, and daily assess the maternal and fetal condition and deliver at 34 weeks. Okay, not before that. Until that, you should continue steroid antihypertensive. If it's a mild disease, you should wait for 34 weeks and then go for the delivery. Okay, but if it's a mild disease, you should hospitalize the patient and continue the maternal and fetal assessment and look at the if its condition is worsening, go for the delivery. Okay, if there is a rupture of membrane, okay, fetal membrane is ruptured, then you go for delivery. So this is treatment. But and don't forget to give the magnesium sulfate and continue after delivery. Okay, so this is the simplified the summary of the hypertension in pregnancy. So here is another data you can read your own self. So, but avoid these drugs because these are the contraindicated in the pregnant woman, and these are the antihypertensive you can give. And this is summary of all the content which we have discussed. And here is the magnesium sulfate summary which we have discussed for the management of eclampsia. Okay, so this is also the in how to you manage the mild preeclampsia and the severe preeclampsia. Okay, thank you very much. Allah Hafiz.